I've heard you say that if you know one person with dementia, you know one person with dementia. Can you tell me what you mean by that?
Well, first, I can't take credit for it. That is something that we say in the dementia sort of research space, caregiving space. If you know one person with dementia, you know one person with dementia. And that is because, one, there are multiple different types of dementias. And I could list all of the typical symptoms of whatever type of dementia someone has, but I can't tell you exactly how that's going to play out. I don't know if those symptoms are even going to happen in your family member, the person you're supporting, the person you're there for, the person you know. I don't know, if it will happen in 6 months, 2 years, won't happen at all. And so that's what makes it really, really challenging. And then there's different family dynamics, right? So did you like the person who now has this diagnosis of dementia? Did you get along? Were you in a happy marriage? Is it your parent? Is it a sibling? All of those different factors matter. And so when you come speak to a clinician, a psychiatrist, a nurse practitioner, your primary care provider, it's really, really hard for us to be able to lay out exactly what's going to happen. And I think that's what makes it so challenging, on top of all the other things that go along with supporting someone.
That is very important information because I know that when people hear the word dementia, they probably have a concept in their mind. And so it's important to know that it's not a one-size-fits-all diagnosis. So I think that's very important.
Somebody goes into caring for someone typically because they want to do something good, right? I owe this person, they were there for me, or maybe there's no one else around, and so I want to step up and be there. But I don't think, whether it's we as healthcare providers, society do a good job of explaining it, or, the person doesn't necessarily understand what's coming. It's tough. Tough is an understatement. Like, it is complicated, complex, difficult, big bad feelings kind of work. There's a lot of guilt with not being able to do what you want to do, still wanting to do things for yourself. Again, for those situations, if you are caring for someone that maybe wasn't good to you, that can be really, really challenging and trying for the person that is trying to be there for the person living with dementia. And even if you had a wonderful relationship, seeing dementia change the personality, change the activities and the things that you wanted to do with that person, change the plans you had with that person, it really is difficult. And so my job, honestly, one of the things I love to do when I'm working with caregivers is to thank them. This work is just so difficult, but it's so important. And we don't have enough thanks and kudos and recognition to give to caregivers who are doing this work. But we need you as a society. We need you to do the work.
I so agree with that point, and I also believe that we need to value the caregiving community more, both the paid and unpaid caregivers. So again, critical for us to have this conversation.